With the onset of digital mammography, women do not complain about the pain of having a mammography performed as much as they have in the past. It is going to be dependent upon the patient. Every woman is different. Their pain tolerance is different. Their medications are different. The time of the month, their cycles, is all going to influence that. We do know that the week before you have your monthly cycle, you don't want to schedule your mammogram. You want to schedule it for the week after because you'll have less fluid retention, and that makes the examination more sensitive. Two other things, caffeine and chocolate, will influence that as well. So if women will monitor those three areas, and that will make the exam a lot more comfortable. And if you have sensitive breasts, be sure to convey that to the technologist too, because there are some cues and communications that we can add in there that will prep you and let you know. We'll talk you through it. We'll coach you through it. Screening mammograms are performed on a yearly basis to document the stability of the breast tissue. And the difference between a screening mammogram and a diagnostic mammogram is that typically that indicates that you're having a problem. And so with a diagnostic mammogram, the testing is much more detailed, and it provides special views that the radiologist will review. Sometimes when you have a screening mammogram and the comparison is done with previous images, there are tissue changes that are visible to the radiologist. And so the radiologist will request additional imaging of that specific area of the breast. So when you come to Clermont Radiology for additional imaging after you've had your screening mammogram, we call that an incomplete test. So we're acquiring more information. It doesn't mean that there is something wrong, but it means that there are changes that we need to document. We need to find out what's going on. So when you come for that additional imaging, I will do magnified views or compression views or additional images with the mammography equipment, followed up with an ultrasound of that area. Now, ultrasound will tell us something completely different because mammography is used for location, location, location. And then when we go to ultrasound, what that does is tells us what type of tissue is located in that area. Whether it's filled with fluid, whether it's tissue overlapping on itself, a solid lesion, lymph nodes. You have lymph nodes all throughout your breast tissue, and sometimes those will show up on the mammogram. So it just provides further information and documentation about what the makeup of the breast is.